Good morning, everyone. I am Megan Rogers with Indiana SHIP. I am the Northwest Region Volunteer Supervisor, and I am joined this morning with my lovely co-hostess, Susan Spilly. Good morning, Susan.
Good morning, Megan.
Good morning, Facebook. Today, Susan has a wonderful presentation for us on a new rule in Indiana called the Medigap birthday rule. So Susan is going to tell us what it is, what it isn't, what you can do, tips and tricks, and everything around the birthday rule. Couples housekeeping items. Please feel free to chat in your questions as Susan goes along, and I will be monitoring those. We do have this recording on Facebook for 30 days after. So you can, if you're watching the recording, you can chat in your questions there as well. Susan and I do monitor those, and it will be posted on our YouTube page for probably about a year or so. So you'll be able to watch it that way as well. So without further ado, I'm going to turn it over to you, Susan, to tell us everything about the birthday rule.
Thank you, Megan. Thanks everybody for joining us today or later. Uh, we're going to talk about something that's really important and it's brand new to the state of Indiana. So if you're watching this from another state, this might not apply to you, but reach out to your local SHIP to find out if your state has something akin to Indiana's birthday rule. And you can find your own SHIP in your state by just going to shiphelp.org. Shiphelp.org. Megan can put that in the chat. Okay, so Hoosiers, listen up. If you have a Medigap plan, also called a supplement plan, you may be able to save a ton of money. And you know what one thing that SHIP counselors have in common besides knowing about Medicare and providing impartial information about Medicare? We love to save people money. And this birthday rule has really done that for us and has helped so many people already in the first, 7 months of this year. Who does this affect? Well, this is for folks who have supplement plans or Medigap plans who are 65 years old and older. Now, of course, in order to have a Medigap policy, you have to have Medicare Parts A and B. Last year's state legislature passed this new rule, HEA, that stands for House Enrolled Act 1226, and that made this birthday rule effective January 1st of this year. What this means is that if you are a Medigap plan holder, you can shop yourself around during your birthday, around your birthday, maybe for a different company. And the benefit is to lower that monthly premium. So say, for example, you're 70 years old and you've had your Medigap plan for 5 years. I will bet you that Medigap plan has increased every year, sometimes twice a year, in premium amounts. This birthday rule allows you to shop yourself, and the companies cannot medically underwrite you, which means they can't look at your medical conditions. And they'll give you a price based on 4 criteria: your gender, your age, your zip code, and if you're a tobacco user. Tobacco users do pay extra for their Medigap or supplement policies. Now, you have to already have a Medigap plan to be able to use this birthday rule. When you're looking at your options, if you currently have a Plan G supplement, for example, you have to just shop yourself for other Plan G. You can't go from an F to a G or a G to an N or an N to a G. You have to shop yourself for the same kind of supplement plan you have. And this goes for high deductible plans. There are high deductible plans for both plans G and F. And remember, you got to shop for the plan you have. Now, the time to do this is 30 days before your birthday and 30 days after your birthday. You can't do it before that. You can't do it after that. You'll just have to wait till the next year. So I don't know when your birthday is, but mark on your calendar 30 days before to check out our website and get some ideas of what companies you might want to call to purchase a different Medigap plan from. Or you can reach out to SHIP and we're happy to do that for you. After this presentation concludes, if we have a minute or two, I'm going to take you to the SHIP website and show you how super easy it is for you to look at other options. Now, when you enroll yourself or purchase a new company's Medigap plan, it will start on the first day of the following month after the day that you sign the application. So if you apply on June 15th and sign that application, your new plan, thus your savings and your premium, will begin July 1st. Here is our website, and you'll see over here that we'll go to Medicare supplement plans. Then you go over here to compare Medicare supplement policies. Then you click on, this is a little fuzzy, but you click on Run Quote. Then you fill in these circles. Now, the green circles are automatically filled. So you just have to check those and make sure that you're a non-tobacco user, female, and you're looking at Plan G supplements. But what the things that you actively fill out, unless you need to change one of these three things, is your zip code, your age, and the effective date of when you want your policy to start. Also up here where it says county, sometimes zip codes go over county lines. So just make sure you're looking for the right county. Then you click on Get Quote. Oops. Now, sometimes this information that you'll see after you run the Get Quote, this is what's going to pop up. It's going to be the cheapest monthly premiums first, and then they get more expensive as you go along. Now, sometimes this is just great information, as this is all people care about. Well, hey, just show me the price. But there are other things to consider. And so if you come over here to the left and you click on this tab that's called Market Analytics, it's going to open up some additional information about these policies and companies. And this is the kind of information you can see. So you can see the adjustments in premiums that they are projecting for the next 5 years or 4 years. You can see an increased history, how much this plan, this policy has increased over the years. It shows you how many people in Indiana they have under this particular group, how many they have nationally, how much they collect in premiums, what their loss ratio is, and the percentage of the market. So this is some really great information. And for you number crunchers out there and people that love details, this is a great thing. Remember, click on Market Analytics. And I'm going to show you this here in just a couple of minutes. Then also on our website is a list of the numbers to the companies. So you can use a broker or an agent who sells that particular kind of insurance. But if you can also just call the company directly. Now, for most of the companies, well, actually all of them except one in my experience, you'll be transferred to someone in that company who is licensed to sell Medigap plans in Indiana. And they will be an agent because only agents can sell supplement plans. So you just talk to that agent. They may not be sitting here in Indiana. They may be in California or Alaska for that matter, but they're licensed to sell in Indiana. And they're all very friendly people. They are in sales for a reason, and they will take your information and get you going on your new policy. But remember, they're licensed to sell in Indiana. I'm sure they're aware of this birthday rule, but it's important that you understand that you're using the birthday rule to buy a different company's supplement plan, because ordinarily that might not be possible for folks if they have had medical conditions for which they've received treatment, or maybe you have a medical condition now. So remember the birthday rule. We also have this list on our website. This is a multi-page list. I'm only showing you a screenshot of the first one. And this shows you the companies, their phone number, and what kind of plans they sell. Now remember, if you want more information on the birthday rule or about anything related to Medicare or Advantage plans or supplements or prescription drug plans at Part D of Medicare, visit our SHIP website. That's where we were originally, and that's where we're going to go here in a few minutes, medicare.in.gov, or just call us at the office. We're open Monday through Friday from 8 to 4:30, minus state holidays. And if you find a new policy that might work best for you, that's going to save you some money, you can contact the insurance carrier directly or work through a trusted agent or broker. So give us a call at any time. We're happy to walk you through it and help you celebrate your birthday by saving some money. Megan, before we take a little field trip to our website, do you want to do that now? Should we do that now?
Yes, I think that would be fantastic.
All right. So let's do that. So who remembers the website? Oops. Let's see here. Sorry, folks. I gotta get out of this and get into my other search engine here.
I think you need to go down to the bottom to get your internet browser.
Yes, thank you. Sorry about that. Whew. You know, when the pressure's on, everything. Okay, so we're going to the SHIP website, which is www.medicare.in.gov. Okay, remember our first thing, this is our general information. We're coming over here to the left. We're scrolling just a smidge and we're clicking on Medicare supplement plans. Then we're going to the middle and we're clicking on compare Medicare supplement policies. Then we wait for it to load. We run quote. Our zip code. Okay, let's just put one in. And later today or tomorrow, I'm going to help a gal who has a supplement policy, a Plan G supplement. And in September, she is going to be turning 71. And she lives in 46219. She is a non-tobacco user. We're going to want this policy to start October 1st. It's auto-filled with Plan G. She's a female. And we're going to get quote.
Oopsies. I think it's thinking.
It is, but I've never seen that. Wouldn't you know?
What? I will see if it pulls up on my phone.
There we go.
Oh, there we go. Okay.
Okay.
It's Monday morning, Susan.
I guess so. All righty. So I know this gal is paying around $160 a month currently for her Plan G supplement. It is not through Bankers Fidelity. I won't say what company it is. But if she wants to change from her $160 a month policy for Plan G to this $128.96 a month policy, she is able to do that. Or she has all of these other companies that might be cheaper monthly premium for her. Because remember I said they're in the order of cheapest monthly premium to the most expensive. Now, her husband is not yet on Medicare, so she would not benefit from this household discount. So she really won't be looking at that. This policy fee here is like an application fee. It's a one-time only deal. So we'll see what she chooses to do tomorrow afternoon when she comes over and we look at her options. So that would save her, you know, a nice little pot of money times 12 for the year. So we'll see what she does. And of course, at ship, ship counselors, it doesn't matter to me what she does. The important thing is that she has the information she needs to make what she feels is the best decision for her. And that's what we do at SHIP, help folks make decisions. Well, we provide information so they can make the decisions for themselves. So remember, if you would like us to run a little comparison, if you didn't catch on to how to do this on your own on our SHIP website at medicare.in.gov, we're happy to do that. Just give us a call and we'll connect you with your most convenient counselor. Okay, that's it on the birthday rule. Mark your calendars and happy birthday. I hope everybody can save some money. Megan, do you want to tell us what's coming up?
Yes. If you take off your screen, Susan, I will pull up my screen. All right. So this is our last Facebook Live of July. We are moving into August already, and we have a full lineup for you. So we are going to start the month off on August the 10th, talking about telehealth and how it's covered by Medicare. There are some different pieces to telehealth, and some will be ending soon, some will be continuing. So we're going to cover all the fun things to know about telehealth. Then we are going to take a field trip. Susan is going to get in her car and drive on over to the Indiana State Fair, and we are going to be live from the State Fair. So Susan's going to tell you everything you need to know about what food they have and where to get the best elephant ear and a little bit on how and where you can get some Medicare info from us. So that's going to be a fun What to Know Wednesday. We are then going to wrap up the month with August 24th. Juan Manuel with SHIP is going to come on and talk about preventative health, what it is, what it isn't, how it's covered, all in Spanish. So feel free to tune in for any of these. We do have in September our new to Medicare webinar as well. That's September 22nd. We did change the date from, I think, like the 17th to the 22nd. So hold on, I'm checking. That doesn't sound right. Does the 22nd sound right to you, Susan?
24th, maybe.
It is the 24th. So I'm glad I didn't pull the graphic. I think I found an old one. We are moving our Canva accounts around, so we're trying to figure out where all our graphics are, so bear with us. So September 24th, we are going to have a webinar new to Medicare at 6 p.m. Eastern. For those that are new to Medicare, or maybe you're old to Medicare, you've had it for years, but you want a little refresher, or you never understood one piece of Medicare, you can certainly come on and we will cover all of the basics with Medicare. We do have that event in Facebook, but you do not watch it through Facebook like these. You will go on Eventbrite and register that way. And the event graphic in Facebook has that link. But if you go onto Eventbrite and you type in Indiana SHIP Medicare, it should come up without a problem. So Susan, that is what we have coming up.
All right. Well, this one was a quick Medicare Monday, but I think it's an important one because it's a brand new thing in Indiana and gives people the opportunity to do something about their premiums. Megan, I know you've helped some people with the birthday rule. So
Yes.
can you share an experience that you've had with the clients?
Yes, I would love to. So we have a gentleman down in southern Indiana, Ruben. And Ruben, he's in his mid 80s. He has a Plan F, and that is not available to new Medicare beneficiaries. But he's had it since he was 65. I think he's 88 now. and he was paying 860 a month, $860 a month for his Plan F. Well, that is a tad bit expensive. So we looked around at different insurance companies down in his zip code, and we got him on one that is 200 something. I think he had a savings of like 650 something a month. Absolutely amazing. Now, his wife has a birthday, and she was on the same or is on the same plan he had originally with the same company, Plan F. So she will be switching to the same company and having a significant cost savings as well coming up in September. So while not everyone is saving it that much, people are still saving. So please, be aware of this, mark this on your calendar. I have one lady whose birthday is in October, so she has me down on her calendar to call like September 5th, 30 days before her birthday. So she'll be calling me and we'll be working to get her switched to a cheaper plan as well.
Well, that's terrific. And I'm thrilled for Ruben and his wife that they're saving so much money. And that's life changing.
Uh-huh.
That's budget busting money there.
Yep.
So that's just terrific. That's just terrific. Thank you for helping him. And, we ship counselors love, if we can't save money for ourselves, we love to save money for other people. So give us a chance
Exactly.
to help you look. If you're not a computer or a website user, we're happy to do it. So everybody have a terrific Monday and a terrific week ending the month of July. And we will see you next Monday.
I
Right?
don't, is it
No,
next Monday?
2 Mondays.
Two
2 Mondays
Mondays,
from
two
now.
Mondays.
2 Mondays. Yeah.
Susan was quizzing me.
Have
We
a
got
good
too
day,
many deep.
everybody.
Have a good day.